Clinical vignette, Puerto Rico medical revalidation style. A 65-year-old male with a history of stable angina, hypertension, and no prior myocardial infarctions presents to the emergency department with complaints of mild dizziness and transient lightheadedness after taking a new medication prescribed for his angina. He denies chest pain, palpitations, or shortness of breath. On physical examination, BP 165 mm, previously 130, 880 mm, HR 78 BPM, regular, red normal, lung exam, clear bilaterally, cardiac exam, no murmurs, normal S1, S2, extremities, no edema, capillary refill 2 seconds. An echocardiogram shows normal left ventricular function, no wall motion abnormalities. Unchanged contractility compared to previous studies. The patient states he took sublingual nitroglycerin just before the symptoms began. Question: which of the following hemodynamic changes best explain this patient's symptoms? Select all that apply. A. Decreased preload due to venodilation. B. Decreased afterload due to arterial dilation. C. Increased contractility due to sympathetic activation. D. Unchanged contractility despite changes in loading conditions. A. Decreased preload due to venodilation. Nitroglycerin is a potent venodilator which reduces venous return preload by pooling blood in the peripheral veins. Lower preload leads to less ventricular filling, lower EDV, decreasing stroke volume and cardiac output, CO, which can cause transient hypertension and dizziness. B. Decreased afterload due to arterial dilation. Although nitroglycerin primarily affects veins, it also has mild arterial dilation effects, leading to decreased systemic vascular resistance, SVR, and afterload. This reduces the work of the heart by making it easier to pump blood. C. Increased contractility due to sympathetic activation. This patient does not show signs of increased sympathetic activation, e.g. tachycardia, diaphoresis, palpitations. Nitroglycerin does not directly increase contractility. If the patient experienced severe hypotension, a reflex tachycardia might occur, but this is not the case here. D. Unchanged contractility despite changes in loading conditions. Nitroglycerin affects preload and afterload, but does not change intrinsic myocardial contractility. The echocardiogram confirms no change in contractility, meaning contractility remains stable despite changes in SV and CO. Correct answers A, B, D. Key takeaways: venodilation, e.g. nitroglycerin, decreased preload, lower EDV, lower SV, possible hypotension, arterial dilation, decreased afterload, reduced cardiac workload. Contractility remains unchanged as nitroglycerin does not directly affect myocardial inotropy. Hypotension and dizziness can occur due to excessive preload reduction, especially in hypovolemic patients.